Okay, hello everybody, and welcome to our session. I can see we have more and more participants joining all the time. This is the WHO UNICEF Joint Monitoring Programme session on the integration of water quality testing in household surveys. If you would like to introduce yourself in the chat box, please do. Please tell us where you work and what is your interest in water quality monitoring. And if you have any specific issues or questions that you would like our panelists to address, please type them as they come to you. But you can see from the slide how we are proposing to use the next 45 minutes. We will start with a presentation from the JMP team on the work that we've been doing to support water quality testing in household surveys and some of the emerging results. We will then move on and address three main questions during this session. So we will be looking at how water quality data from household surveys has been used to inform national policy and programs. And we will have presentations from colleagues working in Ecuador and in Bangladesh. We will then address the question of how can innovations support the scale up of water quality testing, and we'll have a presentation from UNICEF Supply Division. And then we will move on and talk about how the data on water quality from household surveys fits with and can complement wider efforts to strengthen water quality surveillance and water safety planning. And we'll have a short presentation from WHO. I think we will give it one more minute, and then we will begin with our presentations. I just want to check that all of our panelists are now present. Okay, so we now have nearly 50 participants. So I think we will make a start. My name is Tom Slowmaker. I manage the UNICEF side of the Joint Monitoring Programme, which is joint between WHO and UNICEF. And as I think you know, we're responsible for global monitoring of drinking water, sanitation, and hygiene. Without any more ado, I am going to pass over to my colleagues on the JMP team for the first presentation. I would like to encourage all of you to type any questions you have in the chat box as we go along, and we will try to respond, and I will prompt our panelists to make sure they address your questions as they come in. Rick and Rob, over to you.
Thanks, Tom. So my name is Rick Johnston, and I'm Tom's counterpart at WHO. I lead the WHO side of the JMP. And together with Rob Bain today from UNICEF, we're going to focus on how we've been working with household surveys to integrate a water quality testing module into fieldwork. Well, I think everyone knows SDG target 6.1. We have this indicator of the population using safely managed drinking water services, which builds on but goes well beyond the MDG indicator of use of an improved source of drinking water. And specifically, there are three new elements that are added, which come from the human rights criteria of accessibility, availability, and quality. So for safely managed drinking water services, people should get their drinking water from an improved water source, but one which is accessible on premises and where water is available when needed, and where the water is free from fecal and priority chemical contamination. So all of this is a lot more ambitious than the MDGs, and we've seen changes in programming approaches, but it also puts new demands on data and different kinds of data. These data can come from multiple sources, and household surveys are critical, especially for finding out what kind of water supply people are using. Surveys are also very powerful for tracking inequalities. And household surveys typically have already been measuring accessibility with a question about the location of the water source and the time required to collect water. They can also collect information on availability by asking about if water is available when needed. And for quality, information would ideally be available from government or semi-governmental authorities, like a drinking water regulator. But in countries where routine data collection doesn't include water quality, or it includes it only for a portion of the population, then household surveys can provide a useful snapshot of the water quality situation throughout the country. What the JMP does is we collect and compile national data about water, sanitation, and hygiene, and use those to produce national estimates and then aggregate them to regional and global level using standardized methods and the global indicators, including safely managed drinking water services. We also report on the population with basic drinking water services, which means the use of an improved water source, which needs 30 minutes or less to collect water from if it's off premises. And then we also have limited services, that's improved sources that need more than 30 minutes. And of course, unimproved sources like unprotected wells and springs, and finally surface water. So we update the global database every 2 years. And in our most recent report, which came out last year, we found that in 2017, 71% of the global population was using a safely managed drinking water service. And that was up from 61% in 2000. But that means that still 2.2 billion people lacked safely managed drinking water services. And as we've seen, that safely managed indicator draws on those elements of accessibility, availability, and quality. And here's an example from a 2017 household survey in Lao PDR, which had the standard questions on the type of water supply, which showed that 83% of the population was using water from an improved source. Only 1% of those were more than 30 minutes away, so 82% had water that was at least basic, could be either basic or safely managed. But this survey also included questions on accessibility, if the source was located on premises, and availability, if there had been any time in the last month when the household didn't have sufficient water. And in most cases, the water in Lao was located on premises and was available when needed. But this survey also included a measure of E. coli and found that only 16% of the population had water free from E. coli. And as this diagram shows, you have to meet all 3 of the criteria to count as safely managed. So 16% ends up being the final number for safely managed.
Okay, so as Rick was saying, for SDG reporting, we're looking at free from chemical, so priority chemical contamination as well as fecal contamination, and using WHO indicator, which is E. coli, no E. coli detected in 100 milliliters. What you're able to do with this test is to detect levels of E. coli. So there's a risk classification there, which many of you will be familiar with. But the WHO guideline and most national standards are for no E. coli to be detected in 100 milliliters. And depending on the country, national priorities, which are also included in the global indicator where available, are arsenic and fluoride. And typically those will be tested either in the field or also in some cases in a laboratory. This is something that has been supported in a small number of surveys. So what happens in the module over the last, sorry, Rick is sending a message starting, okay. So UNICEF has supported a program called Multiple Indicator Cluster Surveys for over 20 years, which is a multi-topic survey covering a wide range of issues about the well-being of children and their families. Since 2012, the JMP has collaborated with the mixed team to develop a comprehensive module for SDG WASH monitoring, which would include E. coli measurement. In a minute, we'll show you how that works, but in brief, it involves testing water from 2 locations. So a glass of water from within the household, so that you know the quality of the water people are drinking. And then you go to the source of that glass of drinking water to test the water source. So that might be collecting a sample from a borehole or directly from a household tap. What we do is train a member of the existing team, which is often the measurer, so somebody who's responsible for anthropometry, which is measuring children's height and weight, to measure, who also then does the water quality test. So it's not a new person added to the team, it's somebody who is already part of the mixed team. We work with a master trainer that the JMP provides, who works alongside local water quality experts, usually drawn from laboratory staff, but in some cases from the line ministry. And the main thing is to ensure that the procedure is followed very carefully, that there's good hygiene and quality assurance and quality control. For example, teams routinely conduct blank tests to ensure that they're not contaminating the samples through poor hygiene. Field teams often take samples from a subsample of the clusters in the household survey. So they might interview, say, 25 households in a village or in a cluster, but would only do water quality testing in 3 to 5 of those households. This reduces the work burden and ensures that you have a large enough sample to get representative results. And then those results can be grouped into risk levels, as we mentioned earlier. And since the household survey collects a lot of other information about households, we can look for patterns and risk factors. The total cost of adding water quality testing in the module is around $2 to $3 per test for the consumables, and around $1,500 per team for the reusable equipment. Though we are looking at ways to reduce those costs, and Esther will talk about that a bit later. In a mixed survey, there's often around 10 to 20 teams. So the total cost is around $50,000 to $80,000 to add water quality testing. But that's a relatively small proportion of the overall cost of these surveys, which can range from $500,000 to several million. So it makes it quite cost effective relative to running a separate survey for water quality testing. So this chart just shows the expansion of the number of countries that have done the module. So starting with Bangladesh and Ghana in 2012 and 2013 to a very long list in 2019, 2020, with a bit of a question mark about the timing of some of these surveys, as obviously the pandemic is having an impact on when countries are going back to fieldwork for surveys that have been planned, and when they're going to start new surveys that have been in the works for some time. So here we've included countries, a whole range of surveys, many of them mixes, but also others such as the Ecuador and Bangladesh, which Monica will talk to us about later, and a few others, so Philippines, APIS, and increasingly non-mixed surveys that are including this module and adapting it to their surveys. So the ones in italics here are surveys that are planned or for which the fieldwork has started, but for which the final report's not ready yet. So the ones that are not in italics, we'll talk about the results a little bit later. So as Rick said, we're going to show you a short video here, which just illustrates the test that the teams are doing. You have to imagine that this is a kitchen downstairs where I had to produce the video, but you imagine this happening in a whole range of different contexts. You'll see it's a relatively simple procedure.
First, we have a filtration unit with sterile funnels and a membrane. We've got a dehydrated nutrient plate, a small sterile syringe, a larger syringe to pull a vacuum through the filtration unit, an alcohol wipe, an alcohol sanitizer, a permanent marker pen, and some forceps. Lastly, we have the incubation belt, which is used to grow the E. coli colonies. So let's get started. I've got a glass of water here, which I can use for the test. First off, we need to sanitize your hands to ensure that you don't inadvertently contaminate the sample. Next, using an alcohol wipe, we can sterilize the top of the manifold. and the forceps. Next, one of the membranes needs to go on top of the filtration unit. So I'm just going to discard this blue bit of paper and put the membrane filter on top of the filtration unit. Next, being very careful not to touch the inside of the funnel, you can get one of those and place it on top of the membrane. Now we're ready to pour the glass of water, up to 100 millilitres, into the funnel. Next up, using one of the small syringes, going to take 1 millilitre to hydrate the nutrient plate. Next, we need to open the valve on the filtration unit and draw the remaining sample through the membrane. Sometimes this can take 2 pulls. And what we're doing here is any bacteria in the sample will remain on the top of this membrane. So we can remove the funnel, pop it over there, and transfer, using these forceps, the membrane on top of the nutrient pad. The nutrient pad is now ready for incubation.
Okay, so as you can see, it's a relatively quick test, but the field teams would be doing this once for the source sample, so the point of collection, and once for the glass in the household, and then for a subset of those households also doing a blank test. So they get a lot of practice with this. I think the other thing to say is that the incubation belt is one of the options, but also that there's electric incubators that have been used in some countries, and additional tests, as we mentioned, for arsenic and fluoride in some countries. So let's have a look at some of the results. We've got quite a few countries now that have estimates, and we can now look at patterns across, for example, countries in this case. And we're about to publish a thematic report which will include these results and go into a little bit more detail on lessons learned from water quality testing and household surveys. So this chart shows really a wide range of contamination at the point of collection, or the water source, ranging from about 16% in Mongolia on the far right to 90% of the population in Sierra Leone with water that is not free from E. coli. There are also large parts of the population exposed to the sort of dark orange at the top here, so very high risk drinking water with over 100 E. coli per 100 millilitres, and that's over 1 in 3 people in 9 of the countries. The SDG indicator is based on water quality at the point of collection, and as a result of these data, 25 of these countries were able to report on safely managed drinking water for the first time. We can also examine risk factors by looking at, or by linking this information about water services. So for example, water source types, the availability and their location. Here we can see the risk levels at the point of collection by country and grouped by type of water source, so the household's main water source. And you see broad patterns which one might expect, but also substantial variability for the same water source type across countries, and populations exposed to very high risk drinking water, including for water sources that are considered to be generally good, so piped water and packaged water. You do see quite large proportions of the populations in some countries drinking water that is contaminated. As Rick mentioned, there are these two samples, so the sample from the glass of drinking water and also from the source. And if you compare those at national level, we can see that in all countries, the proportion at the point of use is higher, so the proportion that are contaminated is higher. But there's quite substantial variation between countries, and we need to understand why that is happening, and to what extent household water treatment and storage practices are influencing that quality. Household surveys collect a wealth of information about respondents and their living conditions, enabling further disaggregation and examination of inequalities. They're really powerful data sets to understand patterns in water quality. These two charts compare the proportion of the population exposed to E. coli contamination, so that's any contamination at the point of collection and at the point of use on the right-hand side. And that's by wealth quintiles, so the richest in dark blue and the poorest 20% of the population in dark orange. And we see that the poorest fifth are often much more likely to use drinking water sources that are contaminated, and that there are substantial gaps between the richest and poorest in many countries. So if you zoom in on Iraq, for example, here, there's a 60 percentage point gap at the point of use between the richest and the poorest. These data also enable comparisons between and within countries. So this chart from the JMP 2019 household update shows inequalities in the proportion of the population using improved sources of drinking water, which are free from contamination, and focuses in on Paraguay, which is one of the mixed surveys that included water quality testing. And what we see is there are marked differences by wealth and by subnational region in Paraguay. And these data suggest that households in the poorest rural quintile and in Alto Paraguay use drinking water that's at least as likely to be contaminated as the average for sub-Saharan Africa. We also mentioned other water quality parameters, and so although all countries have tested for E. coli, or in one case, DPRK, so North Korea tested for thermotolerant coliform due to difficulties in getting that testing kit. But household surveys also offer an opportunity for laboratory testing for additional parameters, with teams collecting samples and then sending these to a laboratory. And a good example of that was in Ethiopia, where the teams did precisely that. It also opens the opportunity to test for a whole range of other water quality parameters in the laboratory without placing too much burden on the teams. It's also possible to test for very high priority parameters during the field work. And you've got this example from Bangladesh on the left-hand side, and we'll hear more about that in a few minutes from the team in Bangladesh. So it's a lot to cover in a very short presentation. And if you want to learn more about this, please do contact us or visit the JMP and the Mix websites. We'll include links in the chat box in a minute. There's a whole range of resources and the technical support for water quality testing. So the JMP has relied on a fantastic group of experts, consultants who've provided support to field teams and have worked alongside national experts. And but there's a range of resources which are available for people who are planning surveys. And if you want to understand a lot more in the detail about how we have done or how water quality testing has been conducted. There's also thematic reports which delve into the survey results in more detail than the main reports which you would get for these multi-topic surveys. So examples here of those, including the one which should be released in the next week or so. And we've also been supporting further analysis of the water quality findings. And there was a collection of research articles in the journal Nature Partner Journal, Clean Water, which again, we'll add a link in a minute, but that includes more in-depth studies looking at the findings from Ecuador and from DPRK as well. So over to Tom.
Okay, thank you very much, Rick and Rob, and apologies for the connection difficulties. We're going to move on, and we have three big questions that we wanted to address in this session. And the next one is, how has water quality data from household surveys been used to inform national policy and programs? And we have two presentations, one from Monica Pozo, who is at INE in Ecuador, and the second from Dara Johnston, who works for UNICEF in Bangladesh. So I'm going to give each of you 5 minutes, and I'd like to pass the floor over to Monica first for your presentation. Thank you.
Okay, thank you, Tom, for letting us share Ecuador experience. So, well, in Ecuador, drinking water and sanitation services are a public utility, competency of the municipal governments, and rendered by a municipal public enterprise in urban areas and community providers in rural areas. The responsibility of INEC is to implement the statistical development plan for the SDG report. That is why INEC collects water quality data in 2 national household surveys in 2016 and in 2019, including water quality at households' point of consumption for the 2019 survey. To measure water quality, we include a presence-absence E. coli test. The test is a little bit different than the presented in the video. In 2016, the process started with the revision of the survey questionnaires, as well as the inclusion of water quality testing. The entire process had the technical validation of an interinstitutional commission related to water sector. In addition, external cooperation of World Bank, UNICEF, and JMP was important in terms of technical assistance, especially in the instrument design and training, but also for the procurement of supplies. In early 2007, Ecuador published baseline estimates for SDG 6.1. The inclusion of an indicator of drinking water quality within the National Development Plan of Ecuador enforced the national monitoring systems to continue regular water quality monitoring in national household surveys to measure progress. The 2019 survey adopted identical questions for measuring the SDG 6.1, including, again, water quality testing through the same methodology, but 2 water samples per household were taken at source level and point of consumption level. This allowed us to analyze how household hygiene habits can contribute to improving or worsening water quality. The 2019 data was combined with administrative records from water service providers. Through a Sankey diagram that we can see on slide 2, we can see the flow of water contamination in the water cycle. Distribution, collection, that is the source type, quality at source, treatment, and quality at consumption point. This generated important sector learnings with important potential to influence sector policies and decision making. The main finding was that water quality is the main bottleneck to reach access to safely managed drinking water. This made evident that the lack of a clear water quality control and surveillance strategy and implementation. The 2019 survey relied on government funding for supplies and only technical assistance from UNICEF and JMP, showing progressive national ownership for monitoring water quality data. At the end of 2019, the Ministry of Water and UNICEF organized a washbath sectorial review workshop. At the workshop, INEC presented the work it has done to collect information of water quality. Key activities related to water quality improvement were identified in the sector roadmap agreed during the washbath exercise. It's important to highlight that the fundamental role that UNICEF has played in coordinating the work with all the institutions of the sector. And finally, if you want to know more information about this, I can share some links through the chat box of some methodological documents that we have on the institutional page, and also an article published in NPJ Clean Water. Thank you.
Okay, thank you, Monica. That's a great presentation, and it's a really interesting example of how this module has been adapted and adopted by the National Institute of Statistics and also the Ministry in Ecuador, and used for informing national wash sector planning. I'd also like to thank Monica very much for getting up so early in Ecuador to attend our session. I'm now going to pass over to Dara Johnston from UNICEF in Bangladesh. Dara, over to you.
Thanks, Tom. So good afternoon. So it's a pleasure to be able to present the experience Bangladesh has had with the multiple indicator cluster surveys. But as I only have 5 minutes, I'm just going to show the range of data that the mix has provided and some of the important learnings which have evolved. Next slide, please. So since 1994, we have been measuring water coverage in the mixed surveys, and up to 2006. And this has included source, use, time, and availability. Arsenic was not monitored until 2006, but then it was only measured indicatively whether it was there or not. From 2009, water quality measurement has been included. First arsenic in 2009, and then E. coli in 2013. And our most recent mix has been 2019. Next slide, please. So the comparison between the 2013 and 2019 mix results gives very stark differences with arsenic and E. coli, in that we don't see a huge change with the arsenic, but there is a jump in actual E. coli contamination at household level. The E. coli at the source has only reduced slightly, and this fact is probably due because the sources were not sanitized, and it means that the results perhaps are not incomplete. The E. coli at household level has increased, and the significant rise is probably due to unimproved sanitation. With the huge decrease in open defecation, we're seeing a change in the levels of E. coli in household water storage. Next slide. So this is just an example of how the mixed data gives us a wide range of information of the levels of arsenic contamination in the different parts of the country. And it allows for advocacy for the use of resources, especially focusing on the hard-hit areas across the country. Next slide. What we have seen is a considerable reduction in arsenic contamination since 1998. It has gone from 27% down to 11% in 2019, but the absolute numbers are still quite high. The decrease has only gone from 34 million people to 18 million people at risk, and this is because of population increase. So the 18 million is about 11% of the population. Next slide. And this is the E. coli results, both at source and household level. It's varied both at source and household level. You can see there is a consistent doubling of contamination levels, as was mentioned earlier, from the source to the household, and indicating that there are challenges in transport, storage, and handling, as well as the environment around the source. Next slide. The lack of the change in E. coli levels at the source between 2013 and 2019 is a real matter of concern, which has come to light from the study. And the indicators are that it's the environment around the source, usually the hand pump, which is contaminating the water and not the groundwater. We know this because in another study where we looked at 52 unions, the E. coli levels were reduced considerably from 12.6% to less than 1% after the source was sanitized. These unions are the last locations in the country still practicing open defecation. So this indicates that the widespread use of unimproved sanitation is potentially posing a greater risk to drinking water contamination than open defecation. Next slide. So some of the impact and lessons learned. The mix remains the main source of arsenic and E. coli data in Bangladesh, and it is widely used for planning and standard setting. The data has been used to target the most at-risk populations across the country. However, it's clear that an additional step of sanitizing water sources and taking a second water sample is critical to identify contamination routes from source to household. So in the demonstration earlier, where it was mentioned that 2 samples are taken, what we have found is that it's probably necessary to have 3 samples. 1 before the source is sanitized, 1 after, and then 1 at the household, because our results are showing a significant difference in E. coli contamination when you sanitize the source. And finally, the mix data has been instrumental in leveraging both donor technical projects and major government investments. Our own project funded by CEDA has been going since 2018 and into next year, and it's helped to guide the government's arsenic risk reduction project, which is just started last year, and this is a $240 million investment to provide safe water sources for all the arsenic risk areas of the country. And for water access and E. coli in general, a $1 billion project has been launched by the government this year to ensure safe water to reach the SDG 6.1 across the whole country. So that's all. Thank you very much.
Thank you very much, Dara. And it's a really interesting example of how the data has been used to leverage investment programs to address the problem. And I was also really interested in the way in which you've then followed up to try and understand the different sources of contamination and the risk factors, both for arsenic and for E. coli. One of the big challenges with water quality testing, or the big barriers to water quality testing, has been the cost of equipment and the amount of time it takes to get results. And that's something that we've been working with colleagues at UNICEF Supply Division on. And Esther Shaler is now going to give us a brief overview of some of that work on innovations to support the scale up of water quality testing. Esther, over to you.
Awesome, thanks very much. What are we looking at? So within Supply Division, we manage a lot of the procurement of the equipment that the mix team use, as well as other UNICEF offices. And we recognize that the current products that we're using have limitations. They focus on E. coli for measuring risk, but they're also quite complicated, as we saw from Rob's video. There's a lot of steps, and even in the chat, there's discussion around the sterilization and the different processes required. And these complications kind of limit the ability for us to do on-site water testing and use it as a tool as part of behaviour change communication or community engagement with water safety planning, for example. So what we've been looking at under this project is trying to identify new products that are easy to use, have a quicker time to result, significantly quicker in that we're trying to get it under 6 hours, and that they're cost competitive, so that if they are quicker, we can do more of them, and they're going to be cost effective to do that. There's a whole range of attributes that we're ideally looking for from products, which you can find in what's called our target product profile. And the link is in the presentation, or just Google UNICEF target product profile, and you can see what this is. But ultimately this defines what we need a product to do, but not how it's done. We engage with industry and their research and development to try and get them to move towards the products that we want. Thanks, Rick's put the link in the chat box if anyone wants it. So what's the goal of the project? Well, the goal is to be able to identify and procure the most ready products that can help us that can address some of these challenges, and we can use for UNICEF goals, but also that we can support other actors to use. And if we go on to the next slide, you'll see my famous cats that keep coming up in different presentations. I find sometimes this can be a dry topic, so it's a way to jazz it up a little bit. But ultimately, our demand drivers and use cases are, for one, is the surveys, as we're talking about, but also if we have an easy to use product that can give us a quick result, then we can start using water quality testing more in community-led monitoring and also emergency response, which we already do. But when you have to wait 24 hours for a result, it kind of limits how you can use it. And lastly, and probably the biggest use case, is for regulation and surveillance. And we have done a lot of market analysis, and if we can have products that are cost efficient, easy to use, give us quick results, we can get increased volumes of testing being undertaken and hopefully reach the goals of SDG 6 a lot faster. So where are we with this? Next slide, please, Rob. So what have we done? Earlier this year, we released a request for proposals, and we had 11 companies with technologies that are currently available. There was some improvement in time to result, but the technology isn't quite there yet. There's only so fast you can grow a culture of E. coli. And so while we think we're going to get improvements in products, we're not going to get quite where we'd like to get to. But also we're working on how we field test these kind of products so that as they come to market, we know the best ways to be testing them for each use case. WHO and Rick's team have at the same time developed a lab-based protocol for us so that we can evaluate how well these products actually perform. And that work's going to be undertaken fairly soon. They're not only going to look at innovative products, but also looking at current products that we already procure so that we can be clear as to how well they're performing and how reliable they are, which is something that we don't always know. We just have the evidence from the suppliers. And then we have what we nickname our novel work stream. So this is products that don't necessarily measure E. coli or don't use a culture-based method. And we have 16 companies who responded to our request for proposals along this. And they use a range of technologies from qPCR, tryptophan-like fluorescence, which is not something I can say quickly, and some other processes that are currently used in the lab, but not necessarily in the field. And these companies show that there is an interest to engage with UNICEF with the demand, and hopefully we'll have another protocol to use for lab validation of these. But also we need to understand how we can use these products, and if they give us different results, how we can use the result, because at the moment we're recording E. coli, so how would we differ that? And then lastly, the market shaping. We've undertaken quite a bit of work to understand the demand forecast under each use case. And we're hoping that through this we can continue to engage not only with industry, but with different country offices and actors to understand what the incentives for the market are around this. And that's just a really quick summary of where we are. We're hoping to do some field tests of products in some way in the next couple of months. And in the short term, we're hoping there'll be some interim products that offer an improvement, but hopefully in the next couple of years, we can bring to market some products that can give us results within an hour or two. So it's exciting times over here, and we'll see what happens. Thanks.
Many thanks, Esther, and I think lots of people are very excited to see what will come out, some of these new technologies, but also curious to see the results of the lab validation of some of the existing technologies. Very good. In the interest of time, I'm going to move on to our next panelist. And as I think you've seen, the data from a household survey can be extremely powerful, especially when you have no other data available. So particularly for people in rural areas or people who do not use a piped network which is regulated. But these data are not really a substitute for routine monitoring and surveillance. So how do they fit with and complement efforts to strengthen water quality monitoring and water safety planning? I'm going to pass to Jennifer de France, who works on this at the WHO. Jen, over to you.
Thanks so much, Tom. Hello, everyone. Great to be here. So before answering this question, I wanted to start with giving a little bit of background information about the framework for safe drinking water. So this is the key recommendation in the WHO Drinking Water Quality Guidelines to ensure drinking water safety. And at its core is water safety planning, a proactive risk management approach for managing the safety of drinking water by the water provider or the water supplier from the catchment to the household. This should be guided by national regulations, which include targets for water safety, as well as ideally regulations on water safety planning, so risk assessment, risk management. And it should be overseen by a system of independent surveillance, which makes sure that the water safety plans are effective and that these health-based targets are met. So next slide, please. So really what we want to talk about is how do household surveys complement the implementation of these elements of the framework for safe drinking water. So we already heard about this. There's a powerful evidence that's shown through the household surveys, which show that there's a need to improve water safety planning and surveillance. We saw the data about water safety, about the risks in water safety for large parts of the population, as well as the decrease in quality from collection to use. This emphasizes the need for water safety planning, so looking and managing risks from the whole supply chain, including at the household. The data showing the disparities in rural areas also, it points to the fact that more needs to be done to support water safety, so the regulations, management, and surveillance in rural areas. Next slide, please. It also provides the evidence base by what data is unavailable. So we know that SDG 6.1 monitoring, that there's many countries that don't have data to report on this, and often it's the water quality data that's the limiting factor. As we heard from Rick in the beginning, ideally the data would be from regulatory agencies, from governments, and we know that this is missing, and that's why household surveys are being conducted. And so again, this reinforces the need for increasing surveillance. Just to highlight that the UN Water Glass report that WHO leads, it highlights that it's not just about conducting the testing. There's a lot of issues with collating and reporting the data. So it's that whole aspect of surveillance, from the testing to collating and disseminating those results. Next slide, please. So the second way household surveys complement wider efforts to strengthen water quality surveillance in WSPs is by helping really with the capacity building to strengthen particularly water quality surveillance. We heard the great innovative work that is being done under the JMP to identify simpler, cheaper, more user-friendly tests. And this certainly will be helpful on the surveillance side, as we heard, the regulatory side, particularly in rural areas where we see these challenges in low income settings. We can't rely on, fully rely on traditional lab testing. We need simpler, cheaper tests in order to really scale up surveillance in many areas. Also, a lot of the work that's being done related to sampling, the testing, data recording, reporting, as well as dissemination of the results, this can also support strengthening of surveillance efforts in countries. So just to share one example of how countries are thinking about how household surveys can benefit surveillance work. This is an example from Indonesia, where the government of Indonesia is planning to conduct a household survey later this year, including water quality. And they're looking to have those who are tasked with conducting surveillance activities, thank you. Surveillance activities actually carry out the water quality testing activities as part of the household surveys. They're also looking at thinking about what equipment should be used for this testing and household surveys that they can still use when they conduct the routine surveillance. The third point is about embedding the procurement of consumables for household surveys into the national system. So they're looking to see about how they're going to have the funding available for the consumables after the survey for routine surveillance. And then lastly, it's important to ensure that household survey water quality testing results will feed into the national data management systems. And Indonesia is looking to develop an app-based surveillance system, and they'd like to integrate this household data into that data management system. Next slide, please. So just to end, I just wanted to flag very quickly that we have a number of resources to support implementation of the framework for safe drinking water. So I've included a link to the website here if you want more information. And just to highlight, because of the issues with rural areas, I just wanted to flag that we are revising our guidance for small water supply systems. And then lastly, as I have the floor, I just want to promote a session that's later this afternoon on water safety. So really for those, I think a lot of you here would be interested in the discussions within that session. It's at 4 o'clock today. It's called Safe Drinking Water, Too Much to Ask, and it's being convened by the Safe Water Network, World Vision, and WHO. So thank you so much, and Tom, I turn it over to you.
Thank you very much, Jen. And that's a lot of information in a short space of time, but there's some great resources there. So I would encourage people to dig into them and have a look at some of those details, which are extremely useful. If we can just go to the last slide, because I think we have maybe 5 minutes left. And I just wondered if any of our attendees had any more questions that they would like our panelists to answer on any of our headline questions about how the data is being used at a national level, especially in Ecuador and in Bangladesh, around the technological innovations and the validation of the testing equipment, or around the links with surveillance and water safety planning. If you have any questions, please do type them into the chat box. I'm afraid all of our attendees are muted, but type away and we will try to respond. And I'm also going to turn to our panelists to see if they would like to make any final reflections, picking up on those questions that are being typed into the box. So maybe if I can go to Rick first. Do you want to just make any final reflections before we close our session?
No, I think there have been some really interesting comments in the chat. I think there's a lot of interest in finding quicker, easier, cheaper tests that could be applied in the field. So please do share those experiences with us. And we are looking forward to publishing results of the TPP and the lab assessment sometime next year.
Rob, any additional points you wanted to make or reflections on some of the questions that have been asked?
So I'm afraid I can't actually see the chat box, which is a shame, and I'm a bit worried about switching away from the presentation slides. But I mean, I can see, well, I think there's a whole range of presentations here on different aspects, and I mean, to my mind, it's really, it's one thing to present a kind of multiple countries all at once, but I think it is delving really deeper into the data and figuring out what the implications are, where it gets very interesting. I think the question of how it complements and strengthens water quality surveillance, I think it certainly helps from a sort of advocacy and a call to action on water quality surveillance. But I think one of the things that relates to the choice of tests is the extent to which the methods are similar to what is being used in surveillance. And I think it has helped having a membrane filtration approach in terms of the credibility of the testing results. And there's been a huge effort, I think, around that. But at the same time, I can see that as new innovations come in, there'll be a bit of a need to sort of shift people's perspectives about these new tests. So it could take quite some time before let's say household surveys could adopt them, and it may be that behaviour change and perhaps emergency use cases are where you start to see them used first, perhaps.
Okay, very good. And I'd just like to give Monica and Dara a chance to come back in. Monica, thank you so much for your presentation. And this has clearly become an important part of the national approach to monitoring water quality in Ecuador. What do you see as being the sort of next steps or big challenges in Ecuador?
Thank you, Tom. I think the next challenges for Ecuador now is the context that the world is living with the COVID. So I think is to adapt all the tools to can measure that kind of indicators in households, because the contact with the person is difficult in that moments. But also I think all other challenge is the socialization with all the users. And also I think a question that was in the chat box was about that, about share the information with households, because for the laws that we have in Ecuador with statistics and data, we can do that. So, but I think it's important to work in that part, because people need to know also what to do if they have a water contaminated. So I think our challenge is that.
Very good. Thank you, Monica. And turning to Dara now. Any last thoughts as we wrap up our session, Dara?
Yeah, thanks, Tom. I just reflecting on some of the questions about high levels of E. coli at point of collection in some urban systems. We got the same thing, urban and rural. And I'm just wondering about, when I hear about the cost of the testing, so I'm suggesting a third test, before and after sanitizing the source. Reflecting on that, I would say that given a choice, that perhaps surveys should only, if you can't afford the third test, then just do the test after sanitizing the source. You'd still not know whether the source is, the environment is contaminating, but you would know that your groundwater is safe. So that may be an option. But it seems that the challenge of high E. coli levels is something that's in many countries. So we need to think about how we can do this third test.
Great. Yeah, thank you. And I think lots of follow up. Once we have the data in our hands, it triggers a whole series of discussions about what does it mean, how do we respond, and what other information do we need to improve water quality. Last comments from Esther.
I think from my side, it's going to be interesting to see how post-COVID world, what kind of where monitoring fits now, because already in wastewater we're seeing more of an increase in a desire for monitoring as a way of tracking these things. So it'll be interesting, but also from an innovation point of view, E. coli is only one measure. We've got to kind of expand, and I know already there's work going on with arsenic testing, which Dara is involved with. It's just how we can simplify technologies, but also get the right levels of sensitivity and specificity around this. But I'm hoping that based on what Jennifer was saying, we'll see an increase in demand for kind of using these kits for surveillance, and then I can talk nicely to all our suppliers and get more competition in the market, and so hopefully we can get better products out and make it all easier for everyone as well.
Thank you very much. And last but not least, Jen.
Thanks, Tom. I'd like to make 2 comments based on some of the other feedback I've heard. So one, just regarding making sure that I really think, and we've heard that these results can really influence water safety management in countries. And I think to really better do that from the outset of these household surveys, we need to make sure that we involve those stakeholders who are responsible for regulating water quality, who are responsible for conducting surveillance, so that their buy-in and their feedback is considered in rolling those tests out. And then second, related to testing, I just want to, I think everyone knows this, but just to remind everyone, for programming, for ensuring water quality, we should rely on other tests besides E. coli. There's cheaper, simpler tests that we shouldn't forget about, such as if you're disinfecting water, making sure there's adequate chlorine residual, turbidity and pH for looking at effectiveness of disinfection. So just flagging that. Thank you.
Okay, brilliant. And I'm sure we could continue discussing this topic all day, but I'm aware that there are also other sessions going on. So I think it's really just for me to thank everybody for joining the session. I hope you found it interesting. And there are links in the presentation if you want to follow up and have further discussions with the JMP team and with our panelists. I'd also really like to thank our panelists for joining and for presenting today. And we will make a recording available of the session and all of the associated materials and circulate that to those that have attended. So with that, I'm going to close the session, and I hope you enjoy the rest of your Stockholm World Water Week. Thank you very much.